COVID-19 is making us all learn a lot of things we didn't know before. We're learning about epidemiology, we're learning about diagnostics, we're learning about drug treatments, and we're really anxious to see progress on these things. And perhaps most important of all is getting a vaccine, because it's the vaccine that will allow us all to go back to normal. Vaccines are a revolutionary technology. While we're rightly focused these days on the vaccines we don't have, we're also being reminded how the vaccines we do have made such a big difference, saving hundreds of millions of lives. Of course, vaccines go back a long time. In 18th century England, people knew that milkmaids didn't get smallpox. Dr. Edward Jenner realized that there must be something that the milkmaids were exposed to. And in fact, he saw there was a very mild disease called cowpox. And cowpox was so similar to smallpox that he wondered if when the body was exposed to cowpox, that somehow there was protection against getting smallpox, which had a huge risk of killing you. And so to test this idea of cowpox protection, he used the pus from cowpox blisters to actually give that to a young boy, and then later intentionally exposed him to smallpox to see if he would get sick. That was successful, and that became the first vaccination to immunize people to avoid death from smallpox. Now, we've come a long ways since then. We know a lot more about the immune system and biology based on two key factors. We know about different diseases. The first one is about how infectious it is. And one way to measure that is to say if somebody has this disease, on average, how many other people do they infect? That's called R0. The higher the R0, the more contagious the disease is, the quicker it spreads. COVID's R0 is about 2.5. So each person who gets sick then passes it along to 2.5 more people. And so that makes it about twice as contagious as the typical seasonal flu. But look at this. The R0 for smallpox was between 3.5 and 6, at least twice as contagious as COVID, and 4 times more contagious than the regular seasonal flu. The second factor is of the people who get sick, how many of them will actually die. With COVID, it's at least 1%, much higher than flu, about 10 times higher, but dramatically lower than the 30% for smallpox. In the early 20th century, smallpox killed an average of 4 million people every year. Eventually, we got a great vaccine for smallpox, and so in 1979, that became the first and so far the only disease that we've ever eradicated. Now, the smallpox vaccine is not the only one where we've had a dramatic effect. Let's look at measles. 60 years ago, it was killing between 2 and 6 million every year. We don't have detailed data for the whole world back then, but in the United States, the infection rate was around 300 Americans per 100,000. It was in 1963 that John Enders created this measles vaccine. And we can see that the infections and deaths plummeted very quickly. And since the introduction of that vaccine, we've reduced measles infection by more than 99% in the US. Now, just having a vaccine is one thing, but getting it out to everyone who needs it requires additional effort. Let's look at smallpox. What we've seen historically is that in rich countries, we get vaccines out very quickly. Now, that's a little bit paradoxical because the actual risk of disease and death is actually the lowest in those rich countries, and it's much higher in the poor countries. So let's look at measles here. The vaccine was invented in 1963. 10 years later, UNICEF and the World Health Organization decided they wanted to get that measles vaccine out, and they gave themselves a deadline of 1990. So there was 27 years between that invention and before we got substantial coverage in all the countries, protecting even the children in poor countries. In 2000, even though the vaccine was almost 40 years old, we still had over 500,000 deaths from measles, essentially all of them in poor countries. But 2000 was an important year. That was the creation of Gavi, the Vaccine Alliance. Gavi's purpose was pretty simple: help countries in the world, particularly the poorest, buy these vaccines and create the system to get them out to almost every child. And so far, Gavi has helped vaccinate 750 million children. That's quite amazing. This was the dream we had for Gavi, and it's been achieved. It's changed the norm that only kids in rich countries get these new vaccines. Let me give you another great example of this. It was also in 2000 when a new vaccine for pneumonia was licensed in the United States and started moving to other countries. Here's a chart showing the vaccination rates by country. The wealthy countries are shown on the right and the poor ones are shown on the left. We're going to see how this changes over time. You can see that fairly quickly, low-income countries are getting access. It wasn't like measles, where you had almost 20 years that they had no access at all. As you see, that's not what happened. Simply because Gavi existed, virtually every country in the world offers this to the kids who need the most as fast as we can. The next disease Gavi will help us with is COVID-19. First, of course, the research community needs to develop a safe and effective vaccine. I'm confident that will happen because we have a lot of different groups taking different approaches. But once we get it, we can't let it be like measles or smallpox. We cannot leave billions unprotected, even for years. And that's where Gavi's incredible skills come in. It can make sure to procure the COVID vaccine, getting a very, very low price, and figure out the logistics of getting billions of doses out very quickly. When this pandemic is over, we will have learned a lot of lessons, and we will have gained an appreciation for how we need to invest to stop these infectious diseases. Well, fortunately, the innovation in diagnostics, therapeutics, and vaccines will get us largely out of this by the end of 2021. The therapeutics will start to cut the death rate, but the true end comes when between natural infection and the vaccine, we have this herd immunity. And for rich countries, sometime next year, ideally in the first half. It's going to be okay. We're lucky this one wasn't a more fatal disease. I do think this time we'll pay attention and have the same type of practice and preparation. Some countries, did very, very well. The U.S. Did not. Foundation and this group CEPI that we helped create, one of the few things that was done to help be prepared. We're behind a lot of different vaccines. We're funding manufacturing capacity in many different sites, particularly for AstraZeneca, Johnson & Johnson, and Novavax. We may do that for some of the other vaccines, but those are the ones that are the most scalable, low cost, because we're trying to make sure we can end it not just in the rich countries, but also in the developing countries, and that benefits everyone if we achieve that. We're even asking the U.S. to contribute like they've done with other global health crises, which so far they haven't gotten around to that. No, that's just in a list. I'd say it's not as early to come as some of the others. We have really a whole portfolio where some of the later ones probably will be even more effective. The Novavax phase 1 data came out today and looked quite promising, actually above some of the others, to really stop the virus from growing in your upper respiratory tract to block transmission. That's tough. It's easier to block, to reduce sickness than it is to block transmission. Vaccine, in terms of its effectiveness against sickness and transmission, won't be ideal. The phase 3 primary endpoint is for 50% effectiveness, and it may not have the long duration that one of the later constructs will. So some of those, particularly the more expensive ones, will mainly be used in the rich countries as a bit of a stopgap. We'd be lucky to have much before the end of the year, but then enough will complete that during the first half of next year, a number are very likely to get approved. And then we need to scale up. We need billions of doses to get the places that have a hard time doing the sheltering and are already so poor that the economics effects are quite dramatic. So it's the biggest challenge the global health community's ever faced. I think we'll rise to it, even though the right investments were not made, and in the case of the U.S. at least, the lack of organization around testing and trials has been very disappointing.
I say to my brothers and sisters in Africa, if they come up with a vaccine, be careful.
Yes, sir.
Don't let them vaccinate you with their history of treachery through vaccines, through medication. Are you listening?
Yes, sir.
I say to the African presidents,
Yes, sir.
do not take their medications.
Right.
I say to those of us in America, we need to call a meeting of our skilled virologists,
Right.
epidemiologists, students of biology and chemistry. And we need to look at not only what they give us, we need to give ourselves something better.
Yes, sir.
So my teacher told me, don't speak for some, speak for the whole.
Yes, sir.
And now I'm speaking for Black America,
Yes, sir.
for Hispanic America,
Yes.
for the Native American, and for those who are desirous of life. They're making money now, plotting to give 7,500,000,000 people a vaccination.
That's right.
Dr. Fauci,
Teach them, minister.
Bill Gates and Melinda,
Yes, sir. That's right. That's right.
you want to depopulate the earth.
Yes, sir.
What the hell gives you that right? Who are you to sit down with your billions and talk about who can live and who should die? That's why your world is coming to an end quickly, because you have sentenced billions to death, but God is now sentencing you to the death that you are sentencing to others. Yes, Allah is great.
Yes, sir.
So whether I'm present or absent,
Go ahead.
the Executive Council of the Nation of Islam
Yes, sir.
must call our scientists.
Yes. Yes, sir.
Come and let's sit down.
Yes, sir. Right.
Our virologists, our epidemiologists,
That's right.
those of us who know the science. We cannot let them bring anything to us that we don't dissect.
Yes, sir.
Don't you take a vaccine unless you say
Yes, sir.
to our people, we've checked it out,
Yes, sir.
and you better be of the truthful ones.
Yes, sir.
But Farrakhan, if we don't take the vaccine, we're sure to die. You're dying for sure now. They want to quicken death.
Right.
Yes, brothers and sisters, they're in the Bible as the pale horse
Yes, sir.
of the 4 horsemen of the apocalypse. The pale horse had a rider. His rider was death.
Yes, sir.
And everywhere that pale horse went, hell followed behind.
That's right.
This is your history. You're angry with me.
Yes, sir.
I'll take it,
Right.
because the two that back me are very angry with you.
Yes, sir. Yes, sir. Yes, sir.
And the righteous are becoming more angry with you with every passing day. Imagine some Caucasians sitting in a room plotting the death of 2 to 3 billion human beings, calling them useless eaters.
Yes, sir.
That's Satan.
Yes, sir.
That's the mind of Satan.
The virus doesn't have a brain. We're the ones with the brains. The virus is a very simple biologic entity that can enter a human cell and instruct that cell to make more viruses, which can ultimately kill the person it infects, or at the very minimum transmit to another person. It's brutal in its simplicity, it is brutal in its cruelty, but it doesn't have a brain.
I mean, the goal of a virus is to make more virus. It wants to reproduce. It wants to find individuals to pass between. There's many, many, many things that we can do right now with the tools that we have right now to outsmart this virus. And I think that's the unique thing about this particular pandemic. We are all in support of rapidly addressing therapeutics and vaccines, and that will continue. But right now, we have tools that can stop transmission, that could break chains of transmission. I think everybody on the planet needs to understand that they have a role to play. No matter where you live, no matter what occupation you have, no matter what age you are, you can be part of breaking the chains of transmission.
Every life lost matters. I know many of you are grieving and that this is a difficult moment for the world. But I want to be clear. There are green shoots of hope, and no matter where a country, a region, a city, or a town is, it's never too late to turn the outbreak around. There are two essential elements to addressing the pandemic effectively. Leaders must step up to take action, and citizens need to embrace new measures. Whether countries or regions have successfully eliminated the virus, suppress transmission to a low level, or are still in the midst of a major outbreak, now is the time to do it all. Invest in the basics of public health, and we can save both lives and livelihoods. My message is crystal clear. Suppress, suppress, suppress the virus. If we suppress the virus effectively, we can safely open up society.